Now, I get a lot of young patients aged 18 to 21 who are worried about hair loss. And 18 to 21 years old is very young to start experiencing hair loss. Hair loss at this age does suggest quite a high sensitivity to DHT, the hormone that causes hair loss. And a high sensitivity to DHT does suggest that further hair loss is very likely. But what is the best protocol for these 18 to 21-year-olds who have started to lose their hair? So different doctors believe different things about this age bracket. One thing I want you to know is that whilst most men complete puberty by the age of 18, there is some evidence to suggest that some pubertal changes can actually continue up to 21 years old. We know, for example, that the prefrontal cortex in the brain actually continues to develop up to the mid-20s, in fact. I mentioned DHT before as the hormone that mainly causes hair loss, but it also does contribute to pubertal development. As you can see here, these are some examples of some of the changes that DHT is responsible for in young men. But as I said, DHT also causes hair loss. So this age category is in a little bit of a dilemma. The question is, do we inhibit DHT to stop hair loss by taking finasteride, but possibly interfere with the last few drops of pubertal development? My clinical opinion tends to answer no to this question. I do not believe that stopping hair loss is worth interfering with pubertal development. But there are three routes that this group of men can take. The first option is to consider natural DHT blockers instead of finasteride. These natural alternatives do block DHT, but to a much less extent, and so they're much less likely to interfere with puberty. Studies suggest that oral saw palmetto could reduce DHT levels by 20 to 30%, much less than the 70% that finasteride blocks. One study into oral pumpkin seed oil found a 40% improvement in hair counts compared to just 10% improvement in placebo. So these compounds could be a nice balance of putting the brakes on hair loss during this period, during this 18 to 21-year-old period, but without interfering with puberty. There are some patients that come age 18 to 21, they're worried about their hair loss, and they insist on taking finasteride. This next option is for these patients. I almost never recommend finasteride in this age group, but for the young guy whose mental health is being severely affected by his hair loss, for example, then this is what they can consider. So they should first have a detailed pubertal development assessment, ideally by their GP, or better yet, an endocrinologist. The assessment would look at things like their height, whether their growth plates have fused yet, their muscle mass, testicular size, and secondary sexual characteristics like facial hair and voice depth. If everything points to completion of puberty, then finasteride can be considered. The third and final option for this group of men age 18 to 21 with hair loss is to leverage minoxidil. Minoxidil is most beneficial during the early stages of loss when the hair follicles have only been partly damaged by male pattern baldness. Using topical or oral minoxidil at this point can be a great way to buy time until the patient reaches, say, age 22, and finasteride can be introduced alongside the minoxidil. So those are the three approaches that this age group with hair loss can take, and to decide on which is best for the patient, a detailed discussion should be had with a patient's doctor.